So this is a list of the things that vitamin D is linked to. And even though Lachlan can't see this, I'm going to read them out loud because I think it's so important when it comes to these hormones. So when looking at vitamin D is linked to low vitamin D, and again, hers is 24, is linked to colon cancer, breast cancer, prostate cancer. She doesn't have to worry about that, but still very informative. It's linked to an increase in Alzheimer's, increased influenza. So when infections come around, more people are known to have a struggle with influenza and also obtain the symptoms when exposed to influenza when their vitamin D was lower. Tuberculosis is another one that this is a very wimpy infection or fungus, and your body shouldn't let it set up a home in your body. But along with that predictor that a low vitamin D was associated with poor immune systems, people ended up with tuberculosis more often when their vitamin D was low. So you can kind of relate that to this next one, which is general infections are related to a low vitamin D. Type 1 diabetes, which is what Lachlan has, is related to a low vitamin D. So is type 2 diabetes and metabolic syndrome, which is what I think anybody overweight probably has but doesn't know. And we can argue about that a different day. But other things that low vitamin D increase is the risk of asthma. There is a huge correlation with multiple sclerosis, that the lower their vitamin D, the more likely they were to have MS. The rest of these, including heart disease, that was increased risk of heart attacks, chronic fatigue, high blood pressure, other autoimmune diseases, inflammatory markers. Again, when we did those blood tests for Lachlan last week, her inflammatory marker had gone up as her vitamin D went down. It's increased low vitamin D is also associated with obesity, osteoporosis, and osteopenia. Okay, oh, that's a lot of stuff. But what I was
Ow.
right, and you look at the power of a vitamin D, and Lachlan, of all those that I listed, and I know that was a lot, but thank you for just letting me go through them. What do you remember that clicked in your head saying, "Oh, that would be me"?
Um, Fatigue,
Yeah, right.
inflammation.
Mm-hmm.
Um, well, terrified to have a heart attack. That
Right.
doesn't sound good.
Right. So it's amazing to have all these infections or all these risks of vitamin D that go with. I know. I think influenza in our city has just been on the news, and you say,
Oh yeah.
yeah, did you know that if you get if they when they put influenza in the nasal cavities of people, if they had low vitamin D, they were more likely to have the infection set up as symptomatic. Quite the problem that. It was amazing how much their their link to fevers was. I mean, you look at symptoms of when people get influenza. It's when they really get symptomatic that I really spend time saying anything we could do to lower this. But in the past, when I've asked you to improve your vitamin D, what have we talked about? What did I do for your vitamin D?
We talked about supplements.
Right. Okay. Very good. And so I think I've even at one time wrote you a prescription for them, or maybe we always did it over the counter. I can't remember. Was it always over the
Um,
counter?
I don't know. To
Don't
be
know.
honest, I don't
Okay.
know.
We've had a lot of
I don't
prescriptions
remember.
between the two of us. Yes, we have. So, but there is that. You can supplement vitamin D with a pill, or you can have the vitamin D associated with just over the counter things. So this is the here is one of the diagrams that I use to teach people about what does vitamin D do. And it really just kind of it might be the mirror of what we just talked about a minute ago. So as you put vitamin D into our system, the sun really activates it into the active form, where it does all these really cool things. And let's actually use this picture. I think it's going to be better to see this. One of the biggest issues with vitamin D is how much people underestimate what it's doing. So vitamin D really is like an enzyme. And so it goes in and helps all these different parts of the body work. And I'm just going to go through these pictures because I think it really helps people understand. So this one just talks about how it's the breast cancer, colon cancer, prostate cells that it improves. Macrophages are the parts of your body that go in and help eat up those infections. That's where the tuberculosis and the influenza were both impacted. Again, your insulin secretion increases when your vitamin D decreases. That's how it increased the risk of diabetes. When we do those Dr. Boz ratios and they've had low vitamin D, I'm really adamant about saying if we don't fix that, you're never going to increase that Dr. Boz ratio. You're always going to be producing more insulin because that vitamin D is lower. And it has a lot to do with activating the vitamin D. When you look at vitamin D, it increases the absorption of the calcium and phosphate. It also mineralizes the bone, and that's where you end up with the association. Most people, when I say vitamin D, they say, oh, it's going to increase my risk. If I have low vitamin D, it's going to increase my risk of osteoporosis. I'm like, yep, that and so much more. So this one is just a picture of your heart, increasing the squeeze for what your heart can pump out that blood vessels. That's really a powerful part about what vitamin D does. This is just the picture of your parathyroid. And last is the vascular cells, which doesn't mean much to other people, but I've found an incredible difference in when patients have a vitamin D decrease, their heart disease risk increases quite quickly. So, all right, I have another quiz question for you, Lachlan. What is the other way that you could decrease or increase your vitamin D?
Go tanning.
You are totally right.
I don't know if you guys can tell, but I've been tanning.
Yes, last week I actually educated her a little bit about this because I'm like, oh girl, this is really low, and I know we didn't talk about it on air, but it's really powerful. I'm going to show, hopefully, a picture here. Okay, so this is a picture of the United States of America, and it just looks at, in November of 2018, so this is just this past year, what layers of the United States were at risk for not getting enough vitamin D. And as you look at this turquoise level here, that's where they were borderline enough exposure for vitamin D. And you say, if you look at South Dakota, which is where Lachlan and I live, we are in the danger zone, and so is most of the country.
Literally, right now we are in the danger zone.
We are in a danger zone, man. You know, you look at the other things that when it comes to, let's see if this one's, I think, a little bit better. Yeah, this was the other one by Harvard who said anything above this line in the United States shows these people are at increased risk for low vitamin D. So I know my YouTube audience is across the country, and I would love to know if you'll tell me a little bit about where you're from in these show notes. We'll get to those comments here in a little bit. But a powerful predictor of look at how much of America is above that line saying you are at risk for vitamin D. You know, they actually say that the people below this line, the doctors don't need to check it. Now, I don't know if I agree with that, but I'll tell you a couple of other things that, so if you look at the risk of vitamin D and sunscreen, which I can tell you, I have 3 kids that I have put more sunscreen on than anything else. And honestly, they ended up with this problem of a increased risk for, I mean, I was so worried about skin cancer that I put layers and layers and layers of sunscreen on them, but also I was very impressed at how much the sunscreens are blocked. And without this UVB, I don't know if you can see this. I'm trying to see that little ray there. So UVA rays and UVB rays are 2 different rays of sunshine that come through our atmosphere. The UVA rays are the ones that are increased risk of the melanoma. UVB rays are the ones that give you a sunburn, and that inflammation can be a risk factor. But UVB rays are needed for your vitamin D to activate and to be effective. If you supplement with vitamin D, you take in the activated form. But I will contend that the patients where I've seen the absolute reversal of the vitamin D problem have all been associated with getting an increased amount of sun exposure. So all right, Lachlan, you're back on air, and I did something the other day that I thought my dad was going to fall off his chair. So my dad is 75 years old, and I think I've told you this, that he's struggling with his kidney disease. And in that, he has low vitamin D, like many other people. And he has so many medications that he's been on, and his absorption hasn't been great. So he started going to a tanning bed at 76 years old. And he looks at me like, have you lost your mind? It's almost like the same conversation that happens when I'm going to have you eat 80% fat, and it's going to be healthy for you. And the first time you tell somebody that, you're like, no. You've got to decrease the amount of carbohydrates to less than 20. And that high fat diet is going to increase your vitamin D, first of all, but it's also going to be increasing your inflammation problem. I mean, decreasing your inflammation. You're going to fight inflammation better with that high fat diet. Your immune system is going to be stronger. If you have autoimmune problems, they will decrease over time. And those are some of the side effects that happen with a ketogenic diet. But when I told my dad, over time on a ketogenic diet, you will see that the supply of high fat foods increase the fat soluble vitamins like vitamin D. And I will be very curious to see what your vitamin D looks like even in 4 months, especially if we can get some tanning bed. Now, the key to the tanning bed, do you remember what I made you ask the tanning bed person before you got in?
For UVB rays.
Yay! Yes, that's exactly right. And how was it? Did they know what it was?
Yeah, totally. She had the salon that I went to didn't specifically have that because they're building a brand new store across the street, which is supposed to open this week. But the one on the east side has it. But either way, there's a specific bed that is made to help people with vitamin D problems.
That is so great. Yeah, it's actually it's illegal for them, or against the rules for FDA, for them to advertise that it helps vitamin D. But you can go to the literature. If you look back on this YouTube video, you'll see some of the links that I sourced where this is the evidence for vitamin UVB rays, even in tanning beds, have been associated with an increase in vitamin D. The serum levels, the blood levels checked for those people using a tanning bed were highly correlated, and there are several studies showing that. But so when you think of a doctor recommending a tanning bed, what red flag goes off? What have you been told over the last 30 years about tanning beds, Lachlan?
Skin cancer.
Yeah, right. Yeah, skin cancer. So the skin cancer is highly associated with UVA for the malignant melanoma, which is the really dark, scary black skin cancers. Those are not associated with UVBs, but the ones that make you burn are UVB rays. So how many minutes did you go the first time?
Like 7 or 8, something like that.
I tell you, just go really low. We do not want to burn you. That's really not a good idea. We are trying to decrease your inflammation, and your body will respond if you give it a chance to. The melanin in your skin, which is what makes you brown. Well, we are from the butt white land. We are all white up here, and we don't have any sun that, if you looked at back at that map, it really doesn't give us a chance to expose our skin. And from that, our melanin just kind of fades away until it gets stimulated with UVB rays. And then the melanin...
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.